Welcome back to the Federal Executive Forum on the Federal News Network. We're talking about healthcare. We're just getting into specific programs. I'm going to toss it over to you, Seth, at Pure Storage. Give us an example of a program that you all are working on in this sector that you'd like to highlight.
Yeah, thanks, Luke. I think one of the largest one, and it's somewhat purposefully nebulous, is just the data center modernization and data center consolidation. Whereas Ryan talked about foundationally, we have to have the fastest infrastructure available and the most secure infrastructure available to really augment these sort of higher in the stack applications. So if we're talking about analytics, sometimes it's more advantageous to run it closer to the data set if it's gigantic, for instance. So there are certain data sets where gravity and locality is certainly something you have to pay attention to, as well as, security has been thematically one of the biggest things we've talked about. Having a secure infrastructure that allows for legally non-repudiatable sort of evidentiary immutability is certainly an important thing, right? You want to be able to prove that these data sets that are maybe not reproducible, right? It came off telemetry that is not going to be, can't be reproduced, will never happen again. You want to ensure that when it lands on that infrastructure that you can prove definitively that it hasn't been modified, that the golden set is there. And of course, we all want to be good stewards of taxpayer dollars. And the other piece of the infrastructure, which is energy, as Carl put out. So having this infrastructure that is power efficient, that is effective, and is secure is one of the biggest things to foundationally set it up for success, because these are no longer silos of excellence, as I like to call them. This is a collaborative investment that everybody has to make. There are pieces of this puzzle where you need the Servicenow, you need the Snowflake, you need storage on-prem if you can't go to the cloud, underlying all of it that helps facilitate patient care and speed. So we have to work in concert, not in lieu of one another anymore. So that's been the biggest thing, is just evangelizing that this is no longer necessarily a one-shot solution. You're going to have to team, you're going to have to collaborate, and we're all going to have to work together to have all the pieces in the right place. Otherwise, it may not work, or it's going to work in a fashion that wasn't any different or better, right? Status quo is not what we need. Data is getting much larger, and time to results need to be much faster. So how do you do more with less? You build a better foundation, as Ryan put it.
Absolutely. All right, we're gonna roll into top priorities. Ryan, we're gonna start with you. Your very number one top priority for this year.
Okay, tough question. Our top priority for this year is interoperability of networks based on robust health IT standards that I already talked about, that are then certified and required, and that we see come to life in the marketplace, whether it's through the advancement of API-based systems or just inclusion of all the new innovations like Seth talked about, that those workflows are taken into consideration up front, and everything is well coordinated across our federal partners and decision makers.
Coordination, coordination, coordination. Dr. Evans, top priority for you this year.
A hard question, but an easy question. The top priority for us is always the veteran. Focused on delivering services and care to the veteran. And I think maybe I would highlight the executive order that was signed by the president in December on transforming federal customer experience and service delivery to rebuild trust across the government. Otherwise sometimes referred to as putting our people first by improving customer experience and government services, right? This is really important. This is happening really across all of the federal government, all agencies, but it's something that's really, really important, has been important for us in VA for a long time and remains a priority. How do we, a lot of what I was talking about with connected care, connecting digitally with veterans, delivering services, letting folks engage with us and receive the care that they need anytime and anywhere. Top priority.
And enhancing the customer experience for the veterans sounds fantastic, and we all appreciate it. Carl, top priority for you at HHS.
That's an easy one. I was hired because I talked about data. We've talked about data all throughout this so far. And so the top priority at HHS is develop a comprehensive department-wide data strategy. And we are in the middle of doing that. We've got engagement from the deputy secretary on down and to my chief data officer. We're looking at how can we improve the people and the culture associated with how you manage data, bringing in people who are experienced data scientists who understand this kind of thing. We see a lot of pockets of supreme excellence like NIH, CDC. We want that to be more comprehensive. We want data sharing across the department so that the researchers are sharing information. CMS is able to securely share information, but maintain privacy of the individuals involved. We want our internal operations to be efficient as we do this. So how do you manage the data? How do you govern the data? Just the comprehensive look at how we manage and control our data across the department and secure it along the way. I mean, that's a huge concern. So all kinds of things factor into it. But over the next, let's see, where the schedule we've got is pretty aggressive here, but the next 2.5 months, we're moving at light speed to get that data strategy together and begin to develop implementation plans to make parts of it work.
All hands on deck on the data. And I love the pockets of supreme excellence. Very well said there. All right. We are going to wrap it up here. We'd love to talk all day, but we don't have all day. But we have a few short moments. And I want to start with you, Seth. And we always like to end with painting a picture of the future. 2 to 3 years, what does it look like from Pure Storage's standpoint? What is it that you all are developing? Maybe it's out of the Petri dish. Maybe it's still in the Petri dish. What's the demand signal that you're getting as far as positioning for this segment to deliver the goods?
Yeah, I would say that ultimately the biggest signal that we've seen so far is customer experience, right? Ultimately. And that's what everybody on this panel has spoken about. And we have to deliver a better product that allows the people that work on that product to do it basically effectively and efficiently so that everybody above and beyond, can do their part of the workflow. So as everybody on this panel has talked about, there are a lot of moving parts. Ryan does more with coordination before lunch than I think most people have done in their life. And you have to have everything basically in line for that to take place. So Pure is doing a number of things to increase physical storage without increasing the footprint. So keeping the same form factor, the same power draw, but making devices larger. We're making things faster, right? You can't make it larger and slower. That just doesn't equate anymore. So we're trying to be good stewards of power, cooling, taxpayer dollars, our own technology, and then enabling folks to stop focusing on infrastructure, so to speak. A happy infrastructure owner that doesn't have to give up nights and weekends, that's providing a service to everybody that's effective and efficient, is a great solution. And we're trying to solidify the fact that whether it's today or 10 years from now, not even 2 or 3, it will be ultimately the same platform, the same processes. So once it's ATO'd, once you have your standard operating procedure, it can be something that is just lather, rinse, repeat. And quite frankly, it could be automated and orchestrated without having to have human interaction. So,
absolutely. And I would say, moving up that stack, if you will, in comes Servicenow. Jonathan, 2 to 3 years from now, in this sector, I always like to sort of stay with this segmentation.
I think in over that period of time, it's really about the connected clinician, having healthcare providers that have access to the data that they need. We've talked about data a lot. Have processes that are workflowed, that are automated. So it's very simple for people to do their jobs. And when the data tells you something, actions can happen on the back end without a human having to take them. And we can really streamline the way we provide healthcare. And, underlying all of that, I think, is a focus on low code capabilities, putting the ability to create workflows and applications in the hands of business users. You can't have every health IT requirement flow through the office of a CIO. The low code capabilities on the Servicenow platform allow people with program knowledge, with the practical experience to build the systems and applications and workflows that they need to get their jobs done. So let's put those technologies in their hands, build things that work for the patient. You combine that with these ideas of hyperautomation, where we can take low code plus AI plus RPA and other kinds of very, very powerful technologies and put them together in ways that can digitize and automate end-to-end processes. And suddenly it's much simpler to provide healthcare. And that clinician has access to information in the palm of their hands. They can provide exactly the healthcare they need. Things can happen on the back end. So medicine is ordered or supplies are ordered, and people don't have to wait for the healthcare that they so desperately need at times. And that's what I think the future is. And ServiceNow is a big part of that.
Absolutely. And that whole citizen development, I think you're referring to there, big topic these days. And certainly ServiceNow really enables that. Murali, Snowflake, 2 to 3 years from now, where are you all in regards to delivering these types of capabilities to this healthcare segment?
Absolutely. Yeah, if you look at the themes that are popping up in this discussion, right? It's about coordination, it's about collaboration, and it's about how we are connecting physicians and clinicians so they take better informed decisions, right? Now, if you look at it, there are two things that are so critical for this, right? One, we need ability to bring the data together, right? Faster. And then two, generate insights at a rapid pace, right? So the time to insights is so critical. Now, with this context, I want to talk about one of the interesting features or capabilities that we are working on called native application framework. What these frameworks let healthcare organizations do is build and deploy data applications on Snowflake. And let me break this down for you, right? Let's say that if there is an academic organization or a health technology firm that has built a better disease prediction model, they can distribute that model securely through Snowflake Marketplace and share with other health system provider. The other health system provider can take that algorithm or model and deploy it onto their environment and run it on top of their patient data without having to ship their data out of their environment. Now, this opens up lots of possibilities in terms of how quickly healthcare organizations can collaborate, not just with the data, but also with algorithms and applications, and thereby cutting down the time to insights and deliver better care for patients.
Very interesting concept, and we certainly look forward to that capability as sort of unlocking a lot of the environment. Carl, 2 to 3 years from now, you're going to have your whole data structure in place. What do you expect to see when you look around, let's say 3 years from now in your environment?
What I hope to be seeing is researchers sharing research data to improve their results, particularly if we look at National Institutes of Health, Centers for Disease Control. They're already working on this, but I'd like to see that dramatically enhanced where we're seeing that sharing. It's a common issue amongst research labs in the government of having to facilitate that. We worked out that when I was at the Air Force Research Lab. That was my job to facilitate it there. So I've done it before. I think we can do it again. Like I say, we've got some absolutely outstanding CIOs, the operating divisions. The other thing I'd like to see is with our service providers, and by that I mean the healthcare service providers, getting the right information in a secure way that protects patient privacy to the various points of service, whether we're talking clinics, hospitals, pharmacies. If you look at what Indian Health Services is doing with Mitch Thornborough, their CIO there, they're working on a very large modernization program to modernize the Indian Health Service medical records capability. And that's going to be some great work. I'm hoping to help him facilitate that. So those are the things I'm looking to see. And it all comes back around to data. And if I could just slip in a challenge here, Luke, the challenge I think we will face over time is how do we get that qualified, highly skilled IT workforce, data research, data scientist workforce in and attract them to government. I think we have a compelling mission clinician, but there's probably more things we're going to have to work on as a government to attract and retain that talent.
A bit of call to action there. Thank you, Carl. And once again, congratulations, Dr. Evans. Tectonic shift with VHA over the last 2 to 3 years. Fast forward 2 to 3 years, what can we expect?
I think just in following the theme of the comments here, I'll follow on with the data theme. I think as we move forward, we've already talked about over the course of the panel today, the immense amount of data that we're generating within our healthcare systems. We've also talked about interoperable health data where we can start to share data between healthcare systems. The type of data that I don't think we've talked as much about, that I think really we're already seeing the impact, but we're going to see an increasing impact over the next 2 to 3 years, is patient-generated health data being collected from devices or being entered by patients in between their visits with the healthcare system. What's exciting to me is to think about all of that data coming together, the opportunity we have over the next 2 to 3 years to take healthcare system data that is shared across the healthcare system for the benefit of individual patient care, as well as finding new insights in that data, and adding patient-generated health data, inserting that into clinical workflows to drive clinical decision support for providers, to empower patients in better understanding their own health and their health journey, and frankly, to enhance the care or the relationships that we can provide in our clinics, basically improving the provider experience and the customer experience, allowing healthcare to become healthcare because the data is already there, delivering the insights to drive that care delivery.
Fascinating, and we're certainly really looking forward to that. Ryan, take us home. 2 to 3 years, you've got a lot of moving parts going on there, incredible amount of coordination. That's what your office does. What do you expect to see 2 to 3 years from now?
Well, this is what I want to see. So I'll start with that caveat, but and we want to see at ONC. So we, as I touched on earlier, we want to see that patients and providers have a better healthcare experience, no matter the setting, and without any special effort or stress, and just total empowerment of their information. To do that, we want to see and expect to see that standards affecting consent will be established and widely adopted, that we will extend the successes that we've had in the true clinical health record context to public health systems and public health information through efforts like the Data Modernization Initiative and partnerships with the OCIO at HHS, just to make sure that advancements and innovations through machine learning and other algorithmic-based care are fully leveraged and extended to all users who are ready to access those, and to finally make sure that the research needs across the country are met. Again, making that data available to anyone who can take advantage of it, and just specific to the workforce, that we're both making sure that no one is left behind from an equity perspective, and also that we take and capture the lessons learned, especially from the past 2 years, and provide that kind of integrated, holistic learning and knowledge base for the future. So taking health IT and combining it with true traditional IT, but also some of the community-based service needs that clearly are going to be more important in the future.
And really unlocking this fantastic experience. I want to thank each one of you for taking time out of your busy schedules today to join us on this program and doing the important work that you're doing for all the Americans, most notably the veterans and everyone else. And I'd also like to thank the sponsors for supporting us on the show. I'd like to thank the good people here at Federal News Network that make our program so successful and enjoyable. And most of all, I'd like to thank you, the listening audience that tune in every month. You're listening to the Federal Executive Forum, part of the Federal News Network.